Hi everyone, this is Dr. G here. I've had a question that actually goes back a couple of years, and it's a recent question that I just got, but I have to go back a couple of years because it actually is about me. And I've used myself as a case study for several things, and this is one of those things. And that was when I had a breast cancer scare a couple of years ago that did turn out to be okay, but I had a couple of surgeries and a lot of complications from it. But it all turned out okay. I haven't done an update lately, so I thought I would do that and also answer this really great question from a fellow colleague. So the case is she has a person who is 4 months post-op bilateral mastectomy with a lymph node removal on the left. Now, I just had things going on the left, but I also had a node removal as well, which kind of sets you up for some other issues. So this person has visible cording. I'm like, yes, that's exactly what I had as well. But she doesn't have lymphedema or any restrictions, and her range of motion is mostly good. Here's where it differs. I had a pretty intense case of cording and lymphedema. I had a seroma and cellulitis. I had all the things. And that was painful. It was disheartening. I had to go through 2 surgeries. And when I developed a seroma after the second surgery, after no fault of anyone, it's just my body kind of hates me sometimes and loves to create these seromas, which are these pockets of fluid, of lymph. And so instead of the layers healing back together, it just fills again and again and again. So I had to have multiple drains and all kinds of stuff that you really don't want to hear the details on because it's kind of gruesome. So the point is, what about this cording, right? If this person doesn't have lymphedema, now I had a complication of lymphedema, so that meant I really had to take care of that lymphedema, and the cording just kind of, no pun intended, got caught up in all of the watery mess that was there. So I had more of a neural cording and lymphedema before. Now, this is coming from, I also had to enlist the help of other colleagues because I could not have possibly gone through this process without a ton of oncology PT. Like, hands down, hands in the air, all that stuff to the lymphedema PTs out there. They're amazing, amazing. So with that help, I had lots of lymphatic drainage work with my oncology PT, and we were able to handle the lymphedema. I wore compression sleeves. I went to PT a lot for a long time, and insurance did finally cover a pump so that I could actually pump at home. And that was a tipping point because I could not get to PT enough. It just wasn't possible. I also had to hold down a job. I couldn't get to PT enough to get a grip on it, right? Although PT was essential, I could not, the pump alone would not have done it. It was the combination. So when insurance paid for the pump, which was like $8,000, I could pump every day. And that started to really make a difference. And then we had to deal with the cording. So the second time around that the lymphedema happened, it was vascular in nature. So that meant I had these distended veins everywhere all the time. I still have them. When I go to a place that's hot or I get in an airplane with elevation, I do try to pull out my compression sleeve. I do some lymphatic work myself. But lymphedema just doesn't go away. I'm always going to have to manage that. For example, I don't get blood taken out of this arm. When I was in for my last surgery, I didn't have any IVs in this arm, that kind of thing. I'm sure that if you're working with a therapist, they've already told you that. But if they haven't, there you go. Issues to take care of. So getting back to the case, she doesn't have lymphedema. She has mostly full range of motion. And again, this is where my case is a little more severe. I didn't. I had 90 degrees. That's it. That's all I could get after several months of PT and me being a PT and knowing how to get that range back. It was not coming. After I consulted really some of the best experts in oncology PT for cording in the country, we all agreed that we just needed to go at it and be aggressive. Now, this is an individual case, so I'm not saying to my colleague who asked that question, go aggressive and go hard. But after I had been through what I went through, where I tried everything, there was nothing else left, the aggressive manual therapy toolbox got pulled out. And we said, you know what? We've done everything. There's nothing else that we can do. And so what happened there was something that has not been documented in the literature that much, actually. I saw one case of it in the literature. I sent it to the surgeon, who said, let's try it. You're not getting your range back. Clearly you can't live with 90 degrees, right, of elevation. You've got to be able to raise your arm above your head. There's nothing else that you can do. Insurance approved it. And so we went in and cut the cord. Yeah. Now, this was after aggressive manual therapy. So that aggressive manual therapy toolbox got pulled out. We did all the manual therapy things you can think of, including dry needling as a tool. Now, with lymphedema, you would say, oh, you can't dry needle, you have lymphedema. It was all, all hands on deck. There was nothing else that we could try. And so we did it. And the cording was helped with dry needling. It was helped with aggressive manual therapy. But in my case, it still wasn't enough. So we went back in a few months later. Actually, it was just a few weeks later after I started to talk about that particular, treatment option with my surgeon, who was game for doing it. She said, let's get in there and fix it. So I went in for a second surgery, and they literally cut the cord. But here's what happened when she got in there. She was very careful about dissection into the axilla, because she knew how bad the seroma was before. That had, it just went sideways, and it wasn't the surgeon's fault. It wasn't my fault. There was nothing we could do. It just happened. And that's what happens sometimes. So when she went in to do the second surgery, she found that, yes, the cording was bad, the scarring was bad, but I also happened to be allergic to the sutures that they had used internally. So yellow flag, that turned into red flag. How would you know if you're going to be allergic to sutures? You wouldn't. I also happened to be allergic to the antibiotics they gave me after, when the second seroma, which I was so heartbroken about, turned into an infection and turned into cellulitis. So that may not happen to you. I'm just kind of a worst case scenario, right? So to answer your question, what do you do with someone with cording who doesn't have lymphedema and mostly has full range of motion? In my case, after I had tried everything else, more aggressive manual therapy was what made the difference. And so after that surgery, after the second seroma resolved and the infection resolved, and I got through the insurance covering the pump and the lymphatic drainage for therapy to handle all the lymphedema, then we went right back into aggressive mode with manual therapy, and it worked. I almost get emotional talking about it, because I've forgotten now how hard it was to go through that. But it was a daily cry fest, because I would wake up, the seroma's full, it's painful, you can't sleep, and then the drain gets clogged, and then you end up pressing really hard, on the seroma. It's kind of gross, right? There's moments where it would shoot all the way across the room, and because of you have to get the pressure out, right? You have to release that. You have to drain it. It can't just stay there. So I forgot how emotional that process was, and how obviously committed I was to getting better. And so that's why I made this video today, because I thought somebody out there is going through the same thing, and there's not a lot in the literature. There is certainly not a lot on cutting a cord surgically. But in my case, stuck at 90 degrees, there was nothing else that could be done, because we had exhausted all treatments. And now keep in mind, I'm board certified in lifestyle medicine, integrative medicine. I'm doing all those things. I'm controlling inflammation. I'm eating whole food, plant-based diet, anti-inflammatory. I'm taking curcumin. I am doing all the things that you can do holistically and naturally and organically to handle it with integrative and lifestyle medicine and functional medicine. So I'm talking about really, really exhausting everything, not just medical management, not just PT management, but also functional, integrative, and lifestyle medicine management. And even after doing all those things, I still needed surgery. Surgery saved me because they were able to remove all the infection and the nasty scarring that had happened as a result of being allergic to those sutures. After that, again, after I got past the seroma, the healing, we did that manual therapy. I'm absolutely, totally fine. I have full range of motion, and full function. Do I feel it? Yes. For example, when will you feel cording crop up again after you've handled it, right? You can see I have full motion. I can do whatever I want. I'm not limited. I surf, I horseback ride, I do push-ups, I do all the yoga I want, headstands, whatever. Here's when I feel it. When I have an active infection or inflammation process going on. So when I went through my surgery, many of you pop on over to my endometriosis playlist. I've also had endo, have had endo. Choose your tense of your verb. That's a huge inflammatory process. And what happened when I woke up out of surgery? I could feel that lymphedema. I could feel the cording. It doesn't go away. But as you can see, you can have full range of motion, right? And full function. So your cording and your lymphedema does not have to define you. Your cording and your lymphedema does not have to limit you in any way. I wish for you on your journey of healing just all the best care. It took a team, it took a village to help me get better. And I'm doing really well. If you have any other questions about how I'm doing and how I'm managing, because again, lymphedema and cording doesn't go away. It's a lifelong management thing. But I rarely think about it anymore, unless I'm on an airplane, unless I'm in a hot environment, or there's an inflammatory process going on. So if you have any questions about it, put them in the comments. I am very happy to answer those, point you in the right direction, help you find a practitioner that really works for you, and prayers, all the good wishes, all the good vibes and meditations towards your full recovery and healing. If you like this video, don't forget to subscribe, share it with a friend, leave me a comment. I personally read every single one of them and respond. And if you need any more resources that you just seem stuck and can't find them, I do a limited number of free consults, and I have a lot of information on my blog and my podcast, which you can find at garnerpelvichealth.com and integrativlifestylemed.com.